And one of the groups most vulnerable in this pandemic are the homeless. South Africa's President Cyril Ramaphosa has promised that homeless people will be looked after during the lockdown. In Cape Town, that means taking them off the streets and putting them into a camp, which Doctors Without Borders says is more likely to spread coronavirus than if they'd stayed where they were. DW's Adrian Kriesch has been to see for himself.
Cape Town Mayor Dan Plato actually wanted to showcase how well his city is dealing with the homeless during the coronavirus crisis. It has set up shelter for some 1,500 people at a sports field on the outskirts of the city. The mayor and his staff proudly point out a mobile medical clinic. But the upbeat mood quickly changes when we approach the tents where the homeless live behind a fence. Some yell out that they are dying there and have to sleep out in the cold. The police move in.
We don't have to be sit like this. I think we all have women here.
And so no one is being held against their will on the site.
They don't even take notice of the sick people inside. They don't even take notice of them.
Not true, ma'am. Not true.
Lie, sir. You know you talk lies.
Individuals on site are not being held here against their will. They are not being held here against their will.
I don't want to be here. I don't want to be here. We're not safe. You know how many cases, numbers is in here. Every night they're fighting up. We have families, ma'am. We have families to go.
South Africa has introduced one of the toughest lockdowns in the world. That's why Cape Town is housing these homeless. They live in tents and are served regular meals by workers in full protective gear.
They forced me to be here.
Okay.
Only those people who can prove they have a place to stay may leave the heavily guarded camp.
You must remember and understand these people that were really living on the streets. Some of them use drugs and use alcohol and that sort of thing. The withdrawing symptoms figure is quite high because they want to continue their habits, but here they can't, unfortunately. If you allow these people to walk freely around, what do you think what will happen?
At the fence, a man asks us how many coronavirus cases there are now in the country and how many have died. He says that since his arrival he hasn't received any information. But we have to leave. Our media stay is over. The mayor said the situation only escalated because of the presence of so many cameras. He said normally it would be very calm and journalists would be free to come back to have a look anytime. Now, we've tried for several days to get a permit from the city to get back in, but we didn't get any response. Now, we came here again and we were just turned away.
When South Africa registered its first coronavirus infection in early March, the government was swift to implement measures to combat the spread of the disease. While testing capacity and protective gear remain an issue, early figures suggest the strict policies are working.
This is Mbekweni township in the city of Paarl. The cramped conditions mean residents are especially vulnerable to the coronavirus. To prevent the spread of COVID-19 here and throughout South Africa, thousands of health workers are carrying out door-to-door screening.
We're just going to ask members of the household for any signs and symptoms of the coronavirus. And if they have any, then we refer them to the nearest clinic. We don't do swabbing and stuff like this here.
South Africa's coronavirus infections are growing slowly, not exponential. But even the government is skeptical about the official numbers. The hope is that screening can pinpoint unknown outbreaks. The country's first COVID-19 cases had traveled from northern Italy in early March. Since then, South Africa has closed its borders and banned most incoming flights. South Africa has implemented very strict measures already after the first few cases, like a very strict lockdown in the entire country. But can these measures help to avoid a sharp increase in the number of cases? Hospitals throughout the country are getting ready and setting up testing stations. 80% of the population depends on the public healthcare system, and it was already overstretched before the coronavirus crisis started.
I think we've got all our planning ready. It's the unknown that's the issue. So we normally see on average about 150 patients a day. We can probably manage up to about 160, 170 patients a day. It's that unknown of, am I going to see 200, 250 patients a day, and then where am I going to get my resources from if we do jump up to that number?
It's unclear how the pandemic will ultimately play out. But these days in South Africa, there's little sign of despair or resignation in the fight against COVID-19.